Well, good morning, everyone. My name is Lisa Young, and I'm a professor here at the School of Public Policy at the University of Calgary. I'm delighted to welcome you to today's webinar. I want to draw your attention to the Q&A box that you should see on your screen. If you have questions that you'd like to pose to our speaker today, please click on that box and enter your question. And when we get to the question period, I will be gathering the questions and then posing them to the speaker. It's my great pleasure to introduce Marcia Nelson. She is one of Canada's most distinguished public servants. Right now, she's an executive fellow with the Canadian Centre for Advanced Leadership, the Haskayne School of Business, and of course, the School of Public Policy at the University of Calgary. Prior to this appointment, Marcia enjoyed a successful and rewarding career as an executive leader in the public service. She served as Deputy Minister of Executive Council, Cabinet Secretary, and Head of the Alberta Public Service from 2015 to 2019. Marcia was at the centre during several major crises in the province, and we're fortunate to be able to hear from her today on the subject of leading through crisis. So with that, I will welcome Marcia Nelson to the webinar.
Thanks, Lisa. Well, let me start by saying that Alberta has had a lot of experience in the past decade in disaster response. Everything from the 2001 H1N1 flu pandemic, the 2011 Slave Lake fire, the 2013 Southern Alberta floods, and of course, most recently, the 2016 Fort McMurray fire. So key public organizations in this province have really built strong body memory and disaster response. So when crises hit, people know what to do. Response plans have been developed and redeveloped over the years. Protocols have been established. Federal, provincial, municipal roles have been defined. Staff training is strengthened. So people in public service roles are ready when disasters hit. So as a result, Alberta was well prepared to respond to this kind of pandemic. And in fact, the last disaster planning exercise held by the Alberta government in early 2019 involved planning for a scenario that was a highly contagious global pandemic. So we planned for a third of staff being unable to work, workplaces progressively shutting down, really a lot like the experience that we're seeing today. And I think that exercise identified for us a number of critical planning pieces that needed to be looked at, including things like remote working infrastructure and essential services planning. And I think that exercise helped inform the response we're seeing today. So planning's critical, and you're prepared when you plan and because you test those plans. And I think you're prepared when you learn from the past. And as I've said, Alberta's had a lot of opportunity to do just that. In terms of the lessons learned, I think we can see a lot of past experience informing the current response and recovery efforts. After every major disaster, a post-incident review is done to compile an exhaustive set of learnings. And I'm just going to pick through a few from each of those that I think was most important. So if I look at H1N1, I became the Deputy Minister of Health in 2001, just after the H1N1 experience. And this was early in the formation of Alberta Health Services as a single health region. And during H1N1, we saw lots of public health turf disputes between Alberta Health and Alberta Health Services. We saw shortages in flu vaccines, patchy communication, poor coordination with the Alberta Emergency Management Agency. And as a result, that pandemic plan was completely rebuilt, and significant effort was put into sorting out roles between Alberta Health and Alberta Health Services. And I think we're seeing the benefits of that today in Alberta's response. You're seeing streamlined procurement, seamless coordination between the Health Department and Alberta Health Services and Emergency Management Authority, as well as strong communications coming from all fronts. You know, I can't say enough how much Alberta benefits from the single health region model that we have in AHS. AHS has tremendous experience in disaster response. They have the size and the scale you need for global procurement. You know, they're providing a single point of contact for data and communications, province-wide inventory management. I mean, it is a tremendous asset for Alberta to have this single health region. From the Slave Lake fire in 2001, I think it taught us the importance of establishing recovery teams separate from response teams. You know, response teams simply don't have the bandwidth to think ahead past the immediate work that they're doing to get people back home and back home safely. And in order to think about what communities really need to fully recover, separate response teams have become a best practice as a result. From the 2013 floods, I think we learned the importance of managing the politics and the role of political actors. Officials take a lot of leadership in these kinds of events, and you've seen that with Dr. Hinshaw, our Chief Medical Officer of Health here in Alberta. The public service has to step forward, bringing professional advice and planning expertise when things look really grim. And during the floods, we had just too many politicians intervening in the response process. They were visiting flood locations and evacuation centers, diverting resources from relief efforts, making unauthorized public statements, interfering, frankly, with the chain of command. And in particular, there was very poor information sharing with the opposition members whose ridings were really hard hit in those floods. So I think we learned that disasters are not the time for politics. Politics needs to be the sideshow, not the main show when a disaster is underway. When I look at the Fort McMurray fire, I think we learned about the importance of timely and transparent information sharing in public briefings to give insight on the risks that government's weighing when government is making decisions. Officials and the Premier did daily briefings, and ministers did nightly telephone town halls with residents. But I remember at the time the town council was expressing serious concern with the timing of the reentry plan, and they wanted the province to move much faster. So we held a special meeting with the council. We shared the best data we had and the risk assessments we were working with. And I have to say it made a big difference. When they were informed of the risks and they had information to work with, they could make an informed decision, and they agreed to support the approach the province was taking. So from both the flood and fire experiences, I think government learned a lot about the challenges of handling reentry, where you're balancing health and safety with economic hardship and personal stress. People are understandably anxious about getting home. They want to get back to normal. They want to assess the damage and get on with their lives. And they want and need information to understand the risks they face when they're doing that. And of course, governments want to be sure reentry can be safely done, and governments tend to err on the side of caution, especially when related to public health concerns. So balancing these competing interests isn't easy, and publicly sharing information on government risk assessments, I think, is crucial. I know governments will be carefully monitoring public opinion, and they'll be carefully monitoring the general mood to ensure that they're staying ahead of any kind of serious civil unrest or even vigilante action where people, take things into their own hands and act outside of planned government direction. So for this pandemic response, I'm seeing a lot of these lessons reflected and built on. So you saw the government establish a separate recovery planning team very early. They established an external advisory council led by Jack Mintz, formerly the School of Public Policy, to focus on our economic future. I think we're seeing good coordination between Alberta Health Services, and AEMA, as well as the federal government, other provinces, and industry players. So good coordination all around. I think you're seeing a strong response from and really support for leadership from experienced professionals. And we only have to look to Dr. Hinshaw to see what that looks like. I think there's been strong communications and good transparency from the Premier and officials. And I think we've seen a careful staged reentry plan with clear risk criteria shared with us for moving to the next stage. Now, how they're doing in keeping politics from interfering with the execution, I'll leave that to others to judge. And maybe Lisa, as a political scientist, might want to weigh in. But I will say, I think this will be a challenge for this crisis, in part because this crisis is going to last for many, many months. And I think we're already starting to see some of the political consensus start to fray. But I think it's also the new challenges that provide the greatest tests for government, for emergency response. Those things you've never seen before, that you've never planned for or tested. And there's so much new this time. The nature of the virus itself, it's extremely contagious, and there's a lot that's unknown. The impact of some of these unprecedented measures applied across the entire population. I think some of the unique segments of the population that have specific vulnerabilities require unique interventions we've not tried before. You know, seniors in continuing care and large workplaces like food processing plants. You know, the need for physical separation of emergency response staff themselves, you know, how they need to work from home and maintain really effective coordination. And then, as I mentioned, this slow motion emergency of a pandemic compared to a fire or flood, it really leaves the entire public sector on an emergency response footing for an extended period of time. And, you know, this is going to be months, not weeks. And this will significantly tax staff capacity, and it's really going to test public patience and support for isolation measures. And there's much, much more that's new. So this experience, I think, will no doubt provide many important lessons for all of us on future disaster response efforts. And I think we're still facing a lot of uncertainty. We're going to be relying on the judgment of our public sector leaders as we move forward on reactivation in the economy. So to close, I thought I would share some of my key takeaways from my experience in crisis leadership. And the first is stay calm. You know, while everyone around you is kind of losing their minds, you need to be the one to be calm, to set priorities and stay focused on those priorities even while there's a lot happening around you. I think in these instances, collaboration is absolutely key. Personal relationships matter, and I think it's important to establish those relationships well before you need them. I so often picked up the phone when I was Deputy Minister for Executive Council, and I called my counterparts across the country to either ask for help or offer help, and I could do that because I already knew them. I think leaders need to make sure they delegate and empower their staff. You know, do only what you can do as a leader and delegate everything else, and make sure you're empowering your people to do the right thing as quickly as possible. I think this is also the time to lean on expertise. Let the professionals do their work and get out of the way. I can't overemphasize how important communication is. You know, communicate, and then communicate some more. People really need to hear from leaders in this time, and you can't communicate enough. I think people also need to trust their instincts, you know, trust their training, trust yourself. You know, you got your job as a leader for a reason, and you need to really rely on your own instincts and judgment. I'd also really strongly recommend that you take care of yourself and you take care of your people, particularly in times like these. You're going to need to rest and eat and connect with your family and recharge, because this is a marathon, not a sprint. I also think you need to recognize success and celebrate wins along the way, because doing that will help encourage and inspire your people for the long haul. And obviously, you know, you've got to keep your eye on the horizon. You're managing the moment, you're making sure the trains run on time, but you have to be planning for the future, because it'll be on you before you know it. And finally, as I think this presentation shows, you need to take stock afterward. Look for the lessons learned, where there were hits and where there were misses, because those will be so important for the next emergency planning event. And as we know in Alberta, they regularly come. And thank you, Lisa.
Well, thank you, Marcia. That was an excellent overview. I have a question about preparation, just to start us off. And I'm wondering, in the moments in between the crises in government, are there tabletop exercises? Is this something that happens on a regular basis inside government? I think this is something we don't know a lot about from the outside.
Yeah, absolutely. I mean, that, as I recall, that's been happening for the last 10 years. Even after, you know, the H1N1 pandemic, you know, there was a big rewrite of pandemic planning. And as I mentioned, you know, even as late as January, I think it was January 2019, we did a government-wide and we engaged with our partners as well, tabletop exercise planning on how to respond to a global pandemic. And those exercises are so useful. You know, you identify things like, wow, I don't think we have the proper infrastructure to make sure that 80% of our staff can work from home. So it allowed us to do some of the work in advance to make sure we were ready when that hit. So I can't say enough how important testing those plans are, because you find out where the holes are.
That's really interesting. We've got a question from one of the participants on the webinar asking about coordination. And you've talked a lot about coordination, I think, in a horizontal kind of way within government. What about coordination across the different levels of government? How important is that, and how can you set yourself up well to engage in that kind of coordination in a crisis?
Yeah, absolutely. There's existing protocols. We do this work, we plan, we have protocols about who should call who and what should happen when. But I think what really is the magic in that formula is the establishment of relationships. You need to know before a crisis hits what your role is and what the role is of all your partners. And I think it's important that you have really invested in making those relationships live. So again, with the Fort McMurray fire, I was on the phone with the federal clerk, the same day. I was talking with the city managers. I was talking with colleagues in Saskatchewan, BC, Manitoba. We were getting resources from all across the country. So you need to be able to be in a place where you can pick up the phone and talk to people. And similarly, with industry players, that was a unique event. We had all these really significant private businesses that were threatened in the north. And I had relationships where, people could pick up the phone and call me and say, we've got a concern and, here's my problem and how can you help me? So I think coordination is critically important. You need to plan for it, but you also need to invest in those relationships.
We've got another question here. Considering your experience in previous crises, what can you say about what's going to be the most difficult thing or the most challenging thing when it comes to reopening the economy?
Oh, if I only had just one short answer to that, because I think there are so many challenges. I was telling you we do this regular testing, and when we do pandemic testing, we do it to quite a degree. And you work out all the scenarios, you plan all the details, but it always ends with, and then there was a vaccine, right? That's how we end those things, because you can't imagine what it would be like to try and live in this environment under threat of a very serious virus forever. So, the investments in the vaccine will, I think, be very determinative of the challenges that we face between now and then. So I think, my best advice is we need to watch what's happening all around the world, try and learn from the experience of others. I think we are in a beneficial situation that we're in a place in the pandemic that we can do that and learn from others. And, I think if we look back, and experience will show that it's not a straight line, where we can, easily and sequentially move through a plan and then we arrive at our destination. I think we might take a bit of a more circuitous route, but I do know that we've got some great folks doing the work, trying to learn from others and make sure we're having more hits than misses.
So we have a question here that I think really relates to a point that you made about how this crisis is different from many of the ones that we have experience with, because it's going to go on for so long. And the participant has said, I love Dr. Hinshaw, but can she become overexposed so that we really stop really listening to her? And I think that really speaks to the, how long can we all pay attention to this in the way that we have?
Well, I think that's a great question, and I don't think we know. I think that is one of the challenges that government's going to be facing. As I said, there's because it's a slow motion emergency, it's going to test people's capacity, right? It's going to test the capacity of staff to kind of keep, activating at the highest levels and keep having the successes they are, which is significant. But it will also test the capacity of the public to be able to, receive all this information, moderate our behavior accordingly. And I think this is something that governments all across the globe are going to be watching carefully. And I do think it's one of the reasons why we're seeing provinces and countries move as quickly as they are to reactivating their economies, because I think there's a concern that, you know, we will hit the wall on public tolerance and you know, public consumption of all this information. Just in terms of communications, you know, they have their own arc. And I do expect that, you know, over time, you know, the governments will move away from daily briefings, and they'll come up with different mechanisms to share information more effectively. But in the meantime, I think Dr. Dina has done a spectacular job at sharing information with all of us in a way that we can, you know, understand and work with. And I hope she keeps doing it for a good long time to come.
Absolutely. I think there's lots of people who agree with that. We've got a question that's again, very forward-looking. That the participant is saying disaster response is good, but disaster prevention is even better. What we see in Calgary, in spite of the 2013 flood and earlier floods, the city is building billions of dollars on the floodplain. How do we move to disaster prevention?
Yes. Couldn't agree more. You know, crisis management really occurs over 4 phases. The first phase is prevention. You know, the second phase is preparation. The third is response, and the fourth is recovery. And you know, I think what we've seen in pandemic planning is when an event occurs, you know, there's a tremendous amount of effort that gets put into, you know, response and recovery. And then immediately after, there is work that's invested into prevention and then preparedness. But what happens is that tapers off, that interest, that investment, that attention span, you know, it tapers off over time. So we end up in the place where we were going into this pandemic, having learned a lot from H1N1, excuse me, but perhaps not being as prepared as we might be because of the time that had elapsed. So if you think about fires as well, you know, we learned a lot from the 2011 Slave Lake fire that just did not get implemented in time to help us prevent the fires that happened subsequently. Same with floods. So I think it's incumbent on all of us to try and hold ourselves and our governments accountable for investing as much effort, if not more, in the prevention and preparation stages of crisis management as much as we do in the response and recovery.
Yeah. We have an interesting question. In your lessons for public sector leaders, you talked about looking after yourself. And obviously the corollary of this is looking after your people. And one of the questions that we've got here is asking about mental health supports to be in place for public sector workers during this marathon pandemic. And, you know, some working under very difficult circumstances. Do you have any thoughts about that?
Yeah, yes, I do. I recall this when we were working on the Fort McMurray fire. And, you know, people forget that in these events, our own staff in the public service are being affected by them. So we had people lose their homes, you know, we had people lose their jobs, people were very directly affected. And part of the work that we did was to make sure that we had connected with folks and offered them supports through the employee assistance programs and others to make sure that we were looking after our own staff as much as we were looking after other residents. But the question really speaks to some of the pressures on staff when they're responding to these events. And I have to tell you, I mean, these are all those kind of hidden heroes, right? You see the chief medical officer of health speaking, you see the premier speaking, you know, there's a whole bunch of people out in the public domain, but there's thousands and thousands of public servants kind of working behind the scenes under tremendous pressure to make sure not just that we're responding to the events of the moment, you know, responding to the pandemic, but making sure that all the other government services are being offered and continue to be delivered at the level that the public needs them. So it's just critical that we're investing as an employer, it's just critical the Alberta government invests in its people and makes sure that people are aware of the mental health supports that exist, and ensure that if staff need more, that they're aware of it and they're providing it. So there's thousands and thousands of people out there working on our behalf, and we need to make sure that they're healthy as well.
Absolutely. We've got a number of questions that are really all focused around the issue of the possibility of a second or even third wave. And I think that poses a really interesting challenge for decision makers in government who are managing a current crisis, but also then need to think about the possibility of a second crisis next fall, with a population that has been in some ways desensitized in the ways that we've talked about. What kind of advice would you give to the people who are managing these crises to help them get ready for the possibility of a second wave?
Yes, I mean, like many, I've seen various scenarios discussed in the media and in other venues about what the recovery could look like. The experience coming out of and it was a 1917 Spanish flu showed that the second wave was even more pervasive and more deadly than the first wave. There are others that show, series of smaller waves. I'll leave it to the clinicians to kind of talk about the likelihood of those things. But in terms of government planning, I think one of the most important things that governments can do is share as much information as possible with the public on the risk assessments that they're grappling with. Because if people are informed of the risks and have good information, that can help them make good decisions about their own behavior. And I think it would be a mistake to hold that information back out of kind of some concern about whether we can all handle it. I think sharing as much information as possible will help the public be able to support the direction government takes. I think all governments are going to be incredibly cautious. I think they're all, trying to learn from each other, trying to put in place the conditions for success, additional testing, social distancing measures, enhanced contact tracing. But this is work I think that we're all going to have to do together, and we're going to have to learn from others as we go.
So just a managerial question. If we see a lessening of the cases over the summer, if things seem better, with the prospect of a second wave coming, do you send key people on vacation, make sure that they take a rest with the notion that you might need them back and refreshed in the fall? Or do you keep them at their desks to manage the trailing end of the crisis?
Well, I think that question answers itself. I absolutely thank everyone, whether key people or not, because as I've said, there are just thousands and thousands of people involved in managing, the whole of government response. So it's absolutely critical that people start taking time off, start taking vacations. I know senior leaders in the Alberta government that are paying attention to that, for both for themselves and for staff. And sometimes people resist it. They think, I'm so invested in this, I have to be here, I don't want to miss anything. But really the best advice is, you really need to invest in your own health and well-being, because these, the sad truth is there's always another event just around the corner, and you need to have the resources in place in order to be able to react at the highest level. So take that vacation.
Okay, well, this brings us to just before 11:30, which is the time when we're scheduled to end. We still got lots of questions, so some people may need to be signing off now. So we will thank them for joining us. But Marcia, I believe you're willing to stick around for another 5 or 10 minutes to answer some more questions? Fantastic. Okay, this is a good one. What lessons can leaders, government, business, not-for-profits take from Dr. Hinshaw's communication approach?
Oh, I think all of us can learn a lot from Dr. Hinshaw's communications approach. First, she absolutely embodies calm. You know, she's a very calm person. She's not want to engage in hyperbole or unsupported musings. You know, she's very focused on sharing the facts in as much of a kind of unvarnished way as she can. But at the same time, I think she's also been very empathetic, you know, very authentic. She's a human being. You know, she had to self-isolate for a while. She you know, thought she might have some symptoms, and that was going to affect her and her family. And you know, we understood how that was affecting her. She took time off. I think you might recall that in the middle of it. She said, I've got to take a couple of days. And I thought that was just extremely good modeling for all of us. And I also think what's been important is she's been willing to admit where some of the measures have either fallen short or needed to be revised. So she was quite willing to share information with us about what maybe wasn't working, and or maybe was a mistake and needed to be redirected or fixed, because that's part of this process. We're all learning as we go. Some things will work better than others, and we need to be prepared to admit that and change and move on. So I think she was just a stellar example of excellent crisis communications. Of course, we saw many women leaders across Canada in public health roles do the same thing. And I'm just so pleased to see them getting some recognition for their tremendous work.
Absolutely. If I can just add one thing, I've been impressed that every time she talks about the deaths, which are an inevitable part of a crisis like this, she reminds all of us that these are people with families, and that this is you know, this is meaningful and something that we need to take into account, because I think there is a real temptation to get caught up in the numbers in this crisis. So that's been one of the things that's really impressed me.
Oh, you bet. I mean, in health leadership, I think people forget it's not just about managing budgets and staffing ratios and, you know, clinical testing. It's people, and it's people's lives. So the decisions that you make can make the difference of life and death. So it's a heavy burden, a heavy responsibility that these leaders carry. And I think Dr. Hinshaw has provided a very human response for all of us, I think, to model from.
Absolutely. We have a question here about workplace safety, which is going to be an important part of a successful relaunch and recovery to this particular situation. And so our question is asking for any perspective you have on how involved operational health and safety would typically be in crisis recovery planning, and whether we're going to have the capacity here in Alberta to provide the support that's needed to companies as we rev the economy back up.
Yes. Well, in past experiences, occupational health and safety and public health have both been involved on the ground with respect to any recovery. So when you've got a workplace that's been flooded and there's a potential for mold to have grown or toxic substances to have been released in the water, you need to make sure that the proper measures have been taken in order to create a safe workplace for people to return to. So we've always had, you know, very active involvement from occupational health and safety and public health. There is no doubt that those resources will be stretched when you've got an economy-wide event. And so there will be some prioritization of where resources will be deployed, and that'll be based on where we've had the most active rate of infection, and that's, you know, Calgary and some other areas. But this is an area where you just can't skimp. You know, you've got to invest the resources to make sure that people are safe, and that's what those staff will be charged to do.
And we've got a question drawing on your understanding of the health system. The participant is asking, we've now dry docked a lot of the health system. How do we resist rapid scale back up to what was an expensive system in the past? Are there savings that can be achieved from this reduced normal activity?
Mm-hmm. Well, one of the things I sort of have as a takeaway for every event that I'm in is to think about what innovations we can take from what we deployed during the event to help us be more efficient, more effective, higher quality later. And I think one of the innovations that we've seen through this event is the use of e-medicine or telemedicine or remote medicine, whatever you want to call it. And my partner had an experience where he had an inflammation in his knee. It kind of grew to the size of a basketball.
Oh.
He got on the phone with a clinic. They did an assessment over the phone. They examined his historic records through the telehealth portal, and they arrived at a treatment plan. They faxed a prescription to our local drugstore, and within 1 hour he was able to move from having an initial assessment to having a prescription and being on his way. And so that was incredibly effective. It shows what certain kinds of treatment interventions could be. And I think not only could it be a bit cheaper, but it's certainly a higher quality experience for patients, and it can be a lot better in terms of patient outcomes, getting to prescriptions more quickly. So, I would just challenge all the health leaders to think about, all those things that you thought would be impossible to do, that we all of a sudden found was possible during this event. Let's not forget that. Let's build that in. You're laughing, Lisa, because universities have to be thinking the same thing, right? It's impossible to do, and now it is.
If someone had told me I would be teaching online this spring, I wouldn't have believed them. So it's presenting all kinds of innovations and challenges, I think, across many sectors.
Yeah. And again,
Marcia,
lesson for us all to learn.
Exactly. I'll ask one last question, and that is, if you can just give us your sense, looking out beyond Alberta, are there jurisdictions that you're looking at that you think we could learn things from, that are doing a particularly good job?
Mm-hmm. Well, I'm a bit biased. I have been watching internationally. I think we know the poster child for who we shouldn't follow. But I would say I think there are some terrific examples that have similar parliamentary systems of government, similar populations, some similar cultural aspects, and I think of New Zealand and Australia and Germany. And what's impressed me of those jurisdictions is the ability to really look to the science, right? Listen to the professionals, examine the clinical evidence, and take measured approaches where they're fully engaging and informing the population of the risks that they're managing, and being willing to adapt as the situation requires. So I think, others will have other examples, but those are the ones that stood out to me. Well, and not just because there are women that are leading them as well.
I was going to point that out. Well, Marcia, I think on behalf of everyone who's joined us today, I want to thank you, first of all, for your leadership in the public service over many years through many crises, and for taking the time to join us today and giving us a little glimpse into the kinds of preparation that goes on, the kinds of things that will be going on, and really drawing on your experience and wisdom to provide some advice for people who are leading through this particular crisis. I want to thank all of our participants for joining us today, and to let you know that later today you'll be getting an email from the School of Public Policy that contains Marcia's 10 lessons for public sector leaders during a crisis, which I think is a valuable takeaway. So on behalf of the school, thank you very much, and please join us for some of our upcoming webinars.
Thanks, Lisa.
Thank you.